Hi, this video is going to be on some common medications that are found in a hospice comfort care kit. Your hospice comfort care kit may be slightly different, but I'm going to talk about some of the common ones. The most common medication that you'll find is liquid morphine, and liquid morphine is a concentration of 20 milligrams per 1 milliliter. I like to note that because I think that's important to keep track of. If you're communicating and dosing, or a hospice nurse is instructing you on how much to give, make sure that you're talking about the same thing. If the hospice nurse says you need to give 10 milligrams of morphine, that's 0.5 milliliters. And so I also want to show what this one type of syringe that comes with the hospice med. This is an example of it. So if we were going to give 0.25, I have the dosing line up to 0.25 is not focusing very well. Or 0.3 is another common starting dose for morphine, or maybe your client is getting 0.5 milliliters. So you can see that I have it drawn up here to the 0.5. The thing to remember with the morphine is that, again, 20 milligrams of the medication per 1 milliliter, and the 1 milliliter is one full syringe. So if you're talking, make sure you're talking consistent, either milligrams or milliliters. And I think since you're administering in milliliters, it's best to keep your communication in milliliters. So now, to draw up that medication, the cap would be removed from the medication, and again, you would be drawing that medication up and verifying that you have the medication drawn up accurately in that syringe. Another common hospice medication is lorazepam. Sometimes that's comes in a tablet form that is dissolvable under the tongue, and sometimes it's in a liquid. If it's a liquid, you would also use this syringe that comes with that medication. And again, you're going to be paying attention to the dosage of how many milligrams per milliliter, and how are we giving this med? Are we doing it in milligrams or milliliters, and making sure that you're not getting confused by the two. If it's a tablet form medication and they have a moist mouth and they can still swallow, we can put that under the tongue or in the cheek to dissolve. Now, if it's closer to the end of the life where they're not swallowing, their mouth is quite dry, we can crush that tablet, mix it with a couple drops of water to create a paste, and let that absorb under the tongue. Another common medication is Haldol, and lorazepam and Haldol are both given for anxiety or agitation. And back to the liquid morphine, I don't remember if I noted it, morphine is used for pain and trouble breathing. So lorazepam and Haldol are agitation and anxiety. Another common med that you'll see with the hospice comfort care kit is for secretions, either hyoscyamu or atropine. The hyoscyamu is a tablet form that can be dissolved or again crushed with a couple drops of water to create a paste, or the atropine comes in an eyedropper bottle, and those drops do go in the mouth to dry those secretions. So if it sounds wet, the secretion medication can help with that. Oftentimes we also see a couple suppositories with our hospice kit. A Tylenol suppository may be seen, which would be given for fever or pain, but generally we're going to use that for a fever and save our morphine for pain. And also we'll have a bisacoidal suppository for constipation. So with the suppositories, you'll open the wrapper, lubricate the pointy end. If this is our rectum, we're going to insert them into the rectum about 4 inches. We do want those along the rectal wall so they absorb. And I think that covers what we'll see for hospice comfort kit meds. The only other thing that sometimes is included would be something for nausea, maybe a Zofran tablet that's put under the tongue, or sometimes I've seen them include a Compazine suppository for nausea. So there's a couple different things that may vary in your hospice comfort care kit, but I think that's the majority of it. And I really like staff to be able to see the liquid morphine in the syringe and how important it is to know the milligrams and milliliters and use that included syringe.